So for people listening to this, I'm Jenny from All About You Hypnotherapy, and I'm talking to Adam Rose, a practicing dentist within Palmerston North in New Zealand. So with your years of practicing, how many years have you been practicing?
I've been practicing dentistry for 15 years.
Wow.
I was living in the UK
Hmm.
and was working there for 9 years in a multi-surgery practice, and moved to New Zealand in 2008 and have been working in a two-dentist practice ever since.
Right. Well, very, very busy.
Yeah, we keep very busy. See plenty of variation in our clients, from very simple work to very complex work,
Right.
and they all have very different needs as well as their dental needs.
Yep. Yeah, no, awesome. So,
Got a special interest in sedation for treatment with highly anxious patients. We use sedative drugs through intravenous technique and through oral technique as well, just taking a pill before coming in if necessary.
yep. Yep. No, awesome. So has it changed over your years of practicing?
It hasn't changed hugely. Historically, people are generally anxious about coming to the dentist at times, as well as other behavioural needs they have from very young to the very old for all sorts of different reasons.
Yep.
And it interests me working with these kinds of clients.
No, awesome. So sort of what are your thoughts of using hypnotherapy within sort of the field of dentistry?
Hypnotherapy can be very effective, both for anxiety due to all sorts of different dental treatments, from the use of the needles for the injections, which people don't like, the noise of the drill, as well as actual clinical problems such as a heavy gag reflex, lots of retching, people not liking foreign objects in their mouths. And hypnotherapy can help overcome these. Unfortunately, as much as I've recommended it to people for using to overcome these problems, they often don't see that side of things as something to go down, whereas the patients who have gone down that route have really gained some benefit from it.
Yeah, yeah. So everyone's open to it when they feel it's a need. So make the choice for themselves.
Yeah, but it's a tough one. People don't come to the dentist and expect you to suggest to go to a hypnotherapist.
Yeah.
But it really can help. It really has helped in a number of situations, just in my working life,
Hmm.
and I've seen how effective it can be.
Yeah. Are you able to sort of share any of those case studies with us?
Yeah, a couple of cases. One was a gag reflex case,
Hmm.
where a lady literally couldn't have anything in her mouth, a mirror, the little pricky probes that we use at times. But she went to see a hypnotherapist and had one session, I believe, and came back and was completely changed to the fact that she could brush her teeth very comfortably at home, which was very difficult for her beforehand.
Hmm.
And we managed to get some fairly simple treatment done for her, but stuff that she hadn't been able to have done previously when we tried. Other things like needle phobias. When I was in the UK, patients would be referred to a hypnotherapist when I was working at the hospital, and they'd see them 1 or 2 sessions, and it really would help alleviate the fear they have of phobia, which help with dental situations and blood tests and other situations too.
Yeah. So it's sort of a thing that you can work alongside rather than sort of taking over a certain area. It's just working alongside the dentist field and any other fields. So
Yes, completely. The person who I first spoke to about hypnotherapy showed a video of himself self-hypnosing and
hmm.
having quite a complex surgical procedure carried out on himself with no local anaesthetic, no injections at all,
Yeah.
simply the power of hypnosis. He also, through the self-hypnosis, prevented any post-operative swelling, and there
Hmm.
was no bleeding throughout the procedure. It was quite amazing, quite powerful to see.
Yeah. So sort of set you sort of open-minded, or are you sort of quite open to the idea of it can be effective to the right people?
I'm not really open-minded. I'm convinced that it can be very effective. Yeah, having been hypnotised on the course I went on, it's certainly effective.
Yeah. Oh, that's good. So it's not all that make believe on stage shows and things.
The hypnotism for the clinical purposes I've seen is quite different.
Yeah. Yeah.
Yeah.
No, that's awesome. Cool. So where do you feel that hypnotherapy fits in with the modern day clinic?
Oh, people are much more open to alternative therapies, of which hypnosis may be considered along with aromatherapy and things of that nature.
Yeah.
And it's certainly something that it's often seen as an end of a line thing to go to, but I think it should be slightly more at the forefront. I certainly recommend it to a number of patients. Like I say, unfortunately, a lot of patients, I think they don't think it's going to be very cost effective, because going for the one session isn't very cheap.
Yeah.
But you go for one session and that can save you a whole load of problems later on down the line, a whole load of extended appointments, needing of sedation. Can save you, if you can't brush your teeth because of a gag reflex, it can save you needing fillings, and unfortunately we know how expensive they can be.
Yeah, and the pain as well, those kind of things. So.
Yeah, I mean, pain, it can be used for, I mean, you can have pain if you can't seek the treatment because of your fear. That can lead to pain itself. And hypnosis can be helpful with pain management.
So Adam, are there any other areas sort of that works alongside dentistry that hypnotherapy can help with?
I think a big one that people are quite commonly aware of is the smoking cessation and helping with quitting smoking. There are all sorts of ways of doing that nowadays. There's all sorts of help you can get, self-help books, seeing the GP for different medications you can take. But hypnotherapy, I understand, is still a very successful adjunct to these to help with quitting smoking. And quitting smoking, it's good for your teeth, good for your general health, good for your pocket.
Yep, definitely.
As well.
No, that's awesome. So, to anybody sort of watching this video and wanting to find out more, what would you sort of say would they be their first port of call, sort of with dentistry and hypnosis?
If they have a dental fear, I discuss it with your dentist first. Your dentist may be not up to date. Your dentist may be au fait and knowledgeable about hypnosis. If not, phone someone such as yourself, a local hypnotherapist, and discuss your individual needs with them, and they'll be honest and let you know if they think they can help.
Yeah, and find the right dentist as well who is open to working with the client's ideas, I suppose, and views.
Yeah, getting a recommendation to a new dentist if you are seeking out a new dentist because you haven't seen anyone for a long time because of your fear. Asking friends and family is often a good way to find a friendly-faced dentist.
Yeah, no, definitely. So I highly recommend you. Nice smiley face, so that's good.
Thanks, Jenny.
Awesome. I've really enjoyed talking today, and hopefully everybody who's watching this today will have a good insight, and any questions they can contact me, and I'll put some information to contact you as well, so that'd be great. So thanks very much for sharing your views today.
That's great, a pleasure. Thanks very much, Jenny.
Thank you. Take care.